So, a new report filed with the FDA has linked a growing number of suicide deaths to two different antibiotics used to treat serious infections. Joining us to discuss is Heather McCarthy, an Indiana-based attorney whose son Shay died after taking the Johnson & Johnson drug Levaquin. Thank you for being with us, Heather.
Thank you.
Why don't you tell us, Heather, a little bit about your son Shay? He was a young Purdue University student, and how did he actually end up being given Levaquin?
Yeah, and if I could just kind of explain too, and in regard to the suicide
Yes.
issue that's the topic today. But my son, he was a sophomore at Purdue University. He was studying in the atmospheric science program, very renowned program. NASA astronauts go through that program. Very creative young man. Had his whole life since a child issues with nasal congestion. So that summer, we decided we were going to get him surgery for a deviated septum. The Levaquin that he was given, which is a fluoroquinolone, very powerful antibiotic, but it was given as a prophylactic or a preventative measure so that he would not get an infection, prior or after the surgery. He was given a huge supply, 750 milligrams a day for 2 courses. The first was 21 days. That's when he stopped taking it. But immediately while taking it, after the surgery, he was experiencing a lot of confusion and stuff. But, it's hard as a patient, especially when you're given something as a preventative measure, to know. But it became clear afterwards that he was very sure that this drug had caused him a multitude of problems. Unfortunately, in our case, oftentimes they end up in the mental health system. So rather than your provider listening to you, when you tell them, hey, look, I think this drug is doing something to me, you're not given credibility. And then all of a sudden, instead of an adverse drug effect, it becomes an underlying health issue. And oftentimes that's a mental health issue.
You said that your son stopped after the first, 21 days supply of Levaquin. Now, is that because the supply ran out, or there were supposed to be more and he just decided this is making me feel weird, I'm not taking this anymore?
That is very rare. Victims of this have issues after just being given one pill for, let's say, a urinary tract infection. These are very strong antibiotics, and they really shouldn't be used for these type of issues. You know what I mean? Especially as a prophylactic. If you read the labeling for children, those under 18, it's for anthrax exposure and the plague are the uses for this drug. This was clearly an attempt, I believe, by industry to really broaden the use of a drug that should only be used in specific dire circumstances. And in any circumstance, the patient should be given the risk of these drugs, and they are not. And that's where the problem lies. So we're just trying to raise awareness of these drugs. We have a website, www.knowrisks.org, and really focusing on some of the dangers of not doing your own research and not making sure that when you are given a drug, you are provided the risk and the benefits so you can make your own decision as to whether that drug should be part of your health regimen or not.
What is informed consent? Because you hear this word being thrown around all the time with Levaquin.
Well, informed consent to me would mean, first of all, that I have a relationship with my doctor. Because if I don't have that, I'm never going to get informed consent. And that means taking the time to not only explain the treatment or the procedure that I'm going to be, receiving, but also the risk and the benefits. So I can do some of my own research to see if those benefits outweigh the potential risk. And I don't think anyone especially needed a preventative drug or has a cold or a UTI would be willing to take the risks that are associated with this class of drugs.
Correct.
And unfortunately, we're just trusting our doctors, and that's a normal thing to do. And we think this is just an antibiotic, and we don't understand the host of problems that goes with it. And I think that is the danger here, and that is my mission to try to raise awareness of this.
Are doctors being incentivized to prescribe this medication to their patients? It's
interesting how industry kind of, how that works. We know during this time frame, especially when my son was given the drug, 2011 to 2015, there was many warnings reporting to the FDA, the adverse event reporting, numerous reports. And we know those are undercounted because those are reported by doctors and by patients who have adverse effects. But we also know at that time, and I know you've had an opportunity to talk to a colleague of mine, Dr. Martin, there's been a lot of information that's come out that at that time, her husband, in fact, had a hedge fund that he was the CEO of, this Renaissance Technologies, that had numerous stock in these Johnson & Johnson. That's who made the drug at the time. They have a different name now. People were benefiting off these drugs being broadly used. Yes. There's benefits in the stock market. There's benefits to them being used in this broad manner, which puts a lot of patients at risk. We always hear adverse effects are rare. They're rare if a medication is used what it's supposed to be used for, not a cold or a preventative measure to take such a risk with our health and our well-being.
Where is the FDA? Because the FDA is supposed to be monitoring these drugs to make sure that it causes no harm to the people taking them.
It sure does. But when you read about things like Dr. Martin has written about, the warning labels are, they've increased. In 2016, there was a label change. There was recently a new one. But when you really start looking at it, it really just pulls the veil back. These warnings could have been on much earlier.
Sure.
These adverse effects have been going on for, 20 years. The time it takes to really get the push to make a labeling change. It's hard for people like me who have lost a family member because of this, not to see how medicine's incentivized. We are not getting the best treatments. We're getting the most profitable. And the result of that is stories like mine. And I just think it's so important that these stories are heard, because a lot of the mainstream media, it's very hard. And I commend you for having me on today. It's just very hard to get these stories out. And it could save lives.
We've heard not only is it creating suicide problems, but just taking one dose, as you had mentioned, it causes tendon problems where the tendon can snap. It causes muscular problems. And it's a lifetime from one dose, one time in your life taking this.
It causes mitochondrial damage, and you have these victims who have experienced these harms. So much research could be going on right now. My son was aware of what was going on in his body. He wanted to be well. All he wanted to do was get back on his life and go to school. So here he is seeing, mental health professionals. Yes. What happens in this country? How does industry and physicians push this is instead of looking at the underlying issue, they mask it. So what do they mask it with? An even more toxic drug. A benzodiazepine, here, take this for your anxiety.
Yes.
Well, when that anxiety is coming from an adverse drug reaction, you are adding fuel to the fire. That's why it's hard to really look at some of the recent suicides. I know there was recently one with Levaquin in Florida, because a lot of times these patients are given so many other drugs because no doctors believe them. So they think they have these other problems, and they're taking someone who's already having a toxic reaction and layering other drugs on top of that. And that is just, it's not appropriate. I had almost a decade-long lawsuit in my son's case to get some justice from the doctors who refused to listen to him. It was successful. And that just came to a close this past fall. But it's just amazing. Just like, we had cameramen and depositions. One of them stayed after because he had taken this drug and had a lot of the problems and was treated for them and never connected the dots. Wow. And how much longer are people suffering because they don't even know the source of the illness? They think it's some other underlying issue. And, that's why it's just so important that this whole idea of this risk-benefit analysis has an individual. You can trust your health care provider, but trust yourself also. Trust your family members.
Absolutely.
And listen to them, because all too often that doesn't happen. And the result, it could be death or a lifetime of illness. That's just completely unnecessary.
Correct. You have to be your own best advocate. Thank you so much, Heather McCarthy, for joining us on the program. to warn us about suicides linked to Levaquin.
Thank you.